Excellent. Address any bleeding as we come along.
Simulated surgery offers a real-life challenge.
We simulated a bleeding episode in a mannequin. Bleeding is one of the most commonest surgical complications that we encounter.
Let's finish the laparotomy and see what's happening.
Chandrakanth Are initiated the development of simulation-based training to make sure general surgery residents are prepared for the real thing.
When the bleeding starts, then we have to see how they responded to that. You have to be able to develop that calmness so that you can make that decisions.
Residents also practice surgical skills in a lab that is as realistic as possible. For Are, passing along wisdom is a time-honored tradition.
I think it's a rare privilege to be able to teach and influence their careers and their lives. We have all the supplies, or what we call in surgery, tools and toys that we use in the OR.
As both a surgeon and teacher, Are was influenced by his father, who was a surgeon in a remote Indian town.
So from a very young age, my mom used to send me to watch him operate. So I think about 5 or 6, I started going there, plunked me up on a little stool, and I'd watch him. And I still remember seeing what he did and how much people respected him. From that age, there was nothing else I wanted to do.
In addition to surgical residencies in rural and urban settings, Are established an international rotation in India. His efforts as a teacher and administrator contributed to a residency program that is flourishing.
This is a time when programs are decreasing. And here in Nebraska, we're expanding. And that's a real feather in Dr. Are's cap to be able to do that, because it says our residency program is very, very sound.
If everyone can settle down, we're going to go ahead and get started.
Are always looks for ways to improve the care of patients. Routine mortality and morbidity meetings were changed to bring different specialties together.
And we pick cases where we think both sides could learn something from that.
The goal is to make sure patients get the best care possible.
There's a lot of work to do in the hospital always, but he puts his main focus on us learning and becoming better physicians and better surgeons throughout our training.
How it's made me a better surgeon is that caring for my patients, pretty much. He models that. He keeps his focus at the patient. And so that's clear whether he's educating residents, whether he's operating on patients, whether he's in clinic, whether he's teaching students. It's clear that the patient comes first.
Are is proud of the physicians who come out of the University of Nebraska Medical Center armed with the skills and knowledge they need to save lives.
And what I tell residents is don't ever forget that privilege, don't betray the trust, but also remember we're having so much fun and we get paid for it.